Hello, veterans. George Christos for the Veterans Information Channel. Today I want to go over just the 14 diseases and illnesses that the VA recognizes today, the end of 2019, December 2019. So there's 14 of them. The first one is amyloidosis. That's one of the ones I cannot pronounce. It's A-L space amyloidosis. That's number one. Rare disease caused when an abnormal protein, amyloid, enters tissues or organs. We'll just call number one amyloid. Number two is the chronic B-cell leukemias, a type of cancer which affects white blood cells. That's number two. Number three is Clorantz, a similar acneiform disease, a skin condition that occurs soon after exposure to chemicals and looks like a common form of acne seen in teenagers. Under VA's rating regulations, it must be at least 10% disabling within 1 year of exposure of herbicides. Number four, diabetes mellitus, type 2. Type 2 diabetes, disease characterized by high blood sugar levels resulting from the body inability to respond properly to the hormone insulin. So that's a pancreas problem. If you have any problems with your pancreas, if you have diabetes, or you think you have diabetes, you should get it checked out. Number five, Hodgkin's disease, a malignant lymphoma, cancer characterized by progressive enlargement of the lymph nodes, liver, spleen, and progressive anemia. That's number five. Number six is ischemic heart disease, disease characterized by reduced supply of blood to the heart, leads to chest pain. Multiple melanoma, cancer of plasma cells, a type of white blood cell in bone marrow. Number eight, non-Hodgkin's lymphoma, group of cancers that affect the lymph glands and other lymphatic tissue. That's number eight. Parkinson's disease, number nine, progressive disorder of nervous system that affects muscle movement. Peripheral neuropathies, number 10, onset, nervous system condition, causes numbness, tingling, motor weakness. Under VA's rating regulations, it must be 10% disabling within 1 year of the herbicide exposure. Number 11, Porphyria caseosa tarda, disorder characterized by liver dysfunction, so it's liver disease, liver cancer, and a thinning of blistering of the skin. Okay, so besides problems with the liver dysfunction, you can have thinning, blistering of the skin in sun-exposed areas. Under VA's rating regulations, must be 10% disabling within 1 year of exposure to herbicides. Number 11. Number 12 is prostate cancer, cancer of the prostate, one of the most common cancers among men. Number 13, respiratory cancers, includes lung cancer, cancers of the lung, larynx, trachea, and bronchus. That was number 13. And finally, number 14, soft tissue sarcomas, other than well, I'm not even going to go into that. A group of different types of cancers in body tissues such as muscle, fat, blood, lymph vessels, and connective tissues. So these 14, some of them are broad, some of them are narrow. But it's better to lean towards, preventive medicine than to just say, well, this is old age or normal. No, there's nothing normal about Agent Orange. And that's the 14 diseases that they recognize. There's 4 more that have been sitting been approved by Congress, sitting on the desk of the VA secretary since 2016. It's gone through 2 secretaries, and they, oh yeah, we're going to add that, we're going to add that, we're going to add that. So I'm just going to run those down real quick. That's bladder cancer, thyroid disease, Parkinson-like tremors, and high blood pressure. Those are 4 that should be added, need to be added. This academia, science, engineering, medical, they all say those 4, Agent Orange. So, you know, you may be told, well, what you've got is just normal because you're older or whatever. Well, there's nothing normal about what happened to military veterans who went to Vietnam. 3.4 million were in Vietnam, either on the ground or in the water. You know, Blue Water Navy, anybody who was on a ship within 12 miles of Vietnam was drinking water that was contaminated by Agent Orange. And out of that 3.4 million, less than 500,000 of us still alive. And the thing that's most scary here is from the Veterans Medical Healthcare Association, you know, their statistics, 300,000 have been diagnosed with bladder cancer. So the VA is currently treating 300,000 veterans with bladder cancer, and there's only 500,000 still alive. I mean, that right there is just like red flags everywhere, red flags everywhere. So stay tuned to the Veterans Information Channel. This just isn't about Agent Orange. It's about anything affecting veterans. So current matters, what's going on in Congress, what you can do about it. You got to call. It seems, you know, sometimes you just get the voicemail or whatever, but call congressmen, senators in your state, both parties. Don't discriminate. Just call. Call and tell them your concerns. You'd like more bills to be passed before everybody's gone, but not just the military in general. There's things that they've done recently that if you read about it, you wouldn't agree with it. So you got to fight for your rights. And so stay tuned, and please subscribe to our channel. Pass it on to other veterans. Put it on Facebook, Twitter, Instagram. Let's get the message out there, because, you know, time is running out. The clock is ticking. So thanks for tuning in. This is George Christos for VIC, Veterans Information Channel, signing off.